Hello,
Hi.
my name is Vicki,
Hi.
and I'm going to be doing an assessment on you today. Is that okay?
Yes.
Okay. Thank you for letting me come to your house and join this here with you and your wife. Do you have any questions about what we're going to do today, do you think? I'm going to let you know what we're going to do, and I will help you along the way.
No.
What is your name?
Lee Mendoza.
And what city do we live in?
San Antonio.
Okay. And the today's date?
January 27th.
Okay. And how old are you, Mr. Mendoza?
81.
Wow, okay. You look really good for 81. Do you have any hearing problems?
No.
Okay. And I'm going to whisper in both one of your ears at a time. I'm going to whisper two things, and if you could just tell me what they are, okay?
Okay. Red brick.
Okay.
Train track.
Very good. Okay. Now, we're going to move on. Are you having any problems breathing?
No.
No? Okay. And what I want you to do is you're going to cover each nostril like one at a time, and then breathe in and breathe back out. So let's try that one. Yeah, that side. Breathe in and breathe out. And then you're going to switch and you're going to try the other one. Breathe in and breathe out. Okay. Okay. And then what we're going to do is I'm going to palpate, or I'm going to feel your lymph nodes. I'm going to start here in the back and we're going to come forward, okay? So if I'm just going to start right here, okay? And move like this. Come this. And those seem to be fine, okay? And next we're going to do the extraocular movement. So what I'm going to do is I'm going to ask you to look at this pen. I'm going to have you look at this pen and keep your head straight, and you're just going to move your eyes, okay? Good. Very good. Okay. And now we're going to listen to your heart and your lungs, okay? Okay, sounds good. Now I'm going to be listening to your lungs, so what I want you to do is, maybe if you could just sit forward just a little bit, because I'm going to listen to the front part and then the back part as well. Okay? I want you to take a deep breath, okay, with each one. Deep breath. Okay, and then I'm going to do your back, okay? Breathe in. Great, your lungs sound really good. Really good. There's no problems there. And then, okay, so we're going to be checking your muscular strength, okay? So what I'm going to do is I'm going to start out with your head, and I'm going to ask you to push your head back against my hand. Go ahead, there you go. And then I'm going to do this side to side. So I want you to push your head to this side, and I'm going to try to push, there you go. And on this side, come this way, okay. Very good. Next I'm going to do is I'm going to put my hands on your shoulders, and I'm going to be pressing down, and I want you to just, you can just kind of lift your shoulders up, okay? You can do that, okay? Yeah, okay. And then from there, we're going to go to your hands, and I want you to squeeze my hands. You know how to, you can squeeze them tight, but not that tight, okay? No, you probably have a strong grip. Okay, very good. And then I'm going to have you put your hands this way. Well, you can push up, 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 up. Okay, and then we're going to do the other way. And then you push down, 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 down. There you go. Very good. Okay, and then we're going to do the knees. Put your knees together. There you go. I'm going to put them here, and then you just push and bring your knees up, okay?
Both, one at a time?
Both of them together if you can. There you go. Good job. Okay, I'm going to do your ankles next. I think. Okay. I'm going to do your ankles next, and I want you to push back your feet against my hand. Okay, so go back with your foot. Both of them. Yeah, there you go. There you go. And then the other one. Okay. Can you do them, try to do them both together? There you go. Okay. Now we are going to, you're going to put your foot up like it's on a gas pedal. I want you to come forward. Like you're going to go up first.
Both?
Yeah, both of them. And then you're going to go down, back down, and then lift up your back heel. And you're going to go lift up your back heel like this. Okay. And then that's good. So the next thing that we're going to do is the Tianetti assessment, which is going to assess your balance and your gait, which is how you walk, okay? But first we're going to do a few things. You're sitting in a firm chair, which is good. And then I'm going to ask you to stand up. Can you stand up straight for me, please? There you go. Okay. And then I want you to stand straight up. Do you feel dizzy or anything?
No.
Okay. Then, so I'm going to ask you, you've already got your feet a little bit apart. Can you put them apart about 4 inches? There you go. And then, how do you feel?
Good.
Good? Okay. I'm going to ask you to put your feet together. And then I'm going to do the nudge test, okay? And the nudge test is I'm going to push on your chest 3 times, and you're going to, don't fall, but I'm going to push you back a little bit, and I want you to be able to keep your balance, okay, if you can, okay? 1, 2, 3. Very good. Very good. Okay, so now we're going to ask you to close your eyes, and I'm going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now you can open your eyes. Okay, how do you feel?
Good.
Okay, so what I would like you to do now is turn in a circle 360 degrees, and you can do it slow, just completely, either way, it doesn't matter which way you go. Okay, you're just going to turn around into a circle and then come back facing me. Okay, and then you can have a seat. Have a seat. So your balance looks to be very well. You're strong, you have good strength. And so the next thing that we're going to be checking is your gait, which is your walking. Okay, so I'm going to ask you, I know I asked you to sit down, but I'm going to ask you to sit back up, okay? And then I'm going to have you, from here, start here and just walk like 10 feet and then turn around and come back.
Unknown caller.
Spam. Okay, so have a seat, Mr. Mendoza. You did very well. Very good. Okay. Okay, so you don't seem to have any problems with your walking or your balance. And so I feel comfortable that at this point you're not a fall risk, but I do want to go over some things just to make sure and that you're careful. And okay, there we go. Okay, I'm going to go over some things with you about, there's not really any rugs or electricity cords or anything that I see around here
No,
that you can trip on.
no.
But what I would ask is that I did notice that your floor has tile on it. And so I would warn you guys that be careful for anything that's wet. Be careful, make sure you're dry. Make sure that there's no spills on the floor. So that could be a really big fall risk, the tile itself. Okay? And do you have any dogs? Little dogs?
Yes, two.
Two.
Little ones.
Okay. And do they ever get under your feet?
Yes.
Okay.
Sometimes.
So you need to just be careful with them, know where they're at, and so, they could be a fall risk as well. And who lives here with you?
My son, my daughter-in-law, and two babies.
And does your wife too?
Yes, my
Okay,
wife
and your
also.
wife. Okay, your wife, so okay. Just checking.
The old wife.
And so with the children, the main things that we're worried about is, we don't want you guys to get hurt, trip and fall. So we're just going to make sure that the kids keep up with their toys. And I know that mom and dad help with their toys and keep those picked up for you. So those are the things that we worry about. And then another thing is medications. Okay, so earlier I understand that you both are on Medicare and you have a supplemental insurance plan. And so I compared your medications to some local areas around here, and we found that HEB is the cheapest and it's the closest because they are like within less than a mile from your house. Okay, that's good. And speaking of medications, where do you keep your medications?
On the top drawer,
Okay, of the cabinet?
the cabinet.
Okay, so the children cannot reach that, right?
No.
Okay. Now, do you have any problems remembering to take your medication?
No.
Okay, because if you did, you could get the little organizers and, you can put them in for a week or however you want to do that, because that's helpful if it ever happens. And then currently, you guys are able to pay for your medications?
Yes.
Okay, but if there came a time that you were having problems and struggling with your medications, you can always go to your primary doctor and ask them, and they have plenty of resources, or you can call me, the nurse, and I will help you as well, okay? And so yeah, you did great. I think overall you're in very good shape, and I really appreciate you letting me come to do this with you today. Thank you, Mr. Mendoza.
You're welcome.